Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you with another segment. And I love it when you all write in questions because it lets me know what you're thinking about. And it seems that a lot of people have really been thinking about urinary tract infections. So I did get a request about doing a video regarding ureaplasma. And ureaplasma is what we call one of the atypical bacterias, meaning that whenever there's a urine culture done, a standard urine culture at the hospital, ureaplasma and its counterpart mycoplasma is not something that's typically tested for in a regular culture. So you have to send a culture specifically testing for ureaplasma. Now, ureaplasma is something that is actually part of the normal, healthy adult respiratory system and urinary system. However, just like any bacteria, when it starts to overgrow and take over everything, that's when it becomes a problem. So we see it in conditions of urinary tract infection with the traditional burning and stinging and pressure feelings, frequency, urgency that we see with urinary tract infections. And when urine cultures come back negative, ureaplasma and its counterpart mycoplasma are things that we can test for, simply because you can have a ureaplasma infection that, of course, doesn't show up in the regular culture. So, of course, how would you know that you have it unless you specify or your physician specifies to test for this particular bacteria? It's treated with antibiotics. However, it can cause problems called urethritis, which is a chronic inflammation of the urethra, as well as overgrowing in the bladder and the genital system. It's also associated with conditions like bacterial vaginosis that ladies experience as far as vaginal infections go. It can be spread sexually. It can also be very prominent in immunocompromised individuals, such as patients who are on immunosuppressive drugs that cause their immune system to be suppressed. Having said that, it can rarely be seen, for instance, in children, even though it can be passed from mothers to babies during birth. It generally will go away. So if you are a normal sexually active adult and you keep getting negative urine cultures, talk to your doctor about testing for ureaplasma, because that is certainly something that can be treated and can resolve. Now, just like any bacteria, it can cause inflammation in the system just like anything else. So you may still have irritative symptoms even long after the ureaplasma is gone, and you would want to do something and have some sort of treatment to settle down that inflammatory response. So having said that, we'll do another segment on the more extensive, newer cultures that are being done. We'll talk about that in a different segment. Those tests actually do pick up ureaplasma because they test for a whole host of different bacteria. So anyway, hope this helps. Certainly keep sending in your questions because I love getting all of your questions. And as always, thanks for letting 360 Pelvic Health help restore your confidence.